Chapter 7, medication safety. All right, so this is going back over your 6 rights of medication administration. So I want you to skip to slide 5. So again, these are things that we must know before we give meds. We have to establish identity using the 2 patient identifiers, the name and date of birth. We need to know if they have any allergies, if they're experiencing any new symptoms that we need to report. We need to check vital signs before we get started. Okay. And then we need to know when they last ate or consumed a beverage. Okay. Because again, some medications have to be taken on an empty stomach. Okay. I want you to skip to slide 7. I just went over and showed you the drug reference manual. So in the drug reference manuals, making sure that we have the most current version of the Davis Drug Guide for Nurses. You can get this off of Amazon. In here is going to show you, you can list out all of the meds, current meds that are on the market, and it's going to tell you the different brand names it comes in. It's going to tell you what conditions, health conditions that we give the certain med for, side effects that we need to teach our patients about, and then it's also going to tell us some things that we need to assess them for or to look out for. Okay. So it's very important that we purchase this book because you have to know what you're giving. And your resident is going to ask you, what is that? And if you hesitate, they're not going to have faith in you. Okay. They're not going to have faith in you. And then sometimes you'll go into the room and it's going to be a whole family reunion. And somebody is going to be in nursing school. And they're gonna say, "Hey, what is that you're getting?" And you're gonna say, "I don't know. Let me check." If I was in the room, so no, it's okay. Go get your charge nurse. Can I talk to her? I need somebody else. Okay, to get that drug reference manual. All right, go to slide 12. Again, stock medications are over the counter medications. We house them on the cart. We can administer those to anyone that has a medication order. They have to have a medication order. Okay. Slide 13. So you'll have a room that you can prepare your meds in. This medication room should also have the refrigerator that houses your liquid meds that have to be refrigerated. So it'll have narcotics in there as well. So not only do you count the narcotics that's on the cart, once you're done counting those, you have to go to the refrigerator. So again, the medication rooms and cart must be kept locked when you're not using them. If you're going to walk away from your cart, lock it. Never leave the keys in the cart. Okay? Never leave pills, patient information, anything on the top of your cart if you're getting ready to leave or walk away from it. Okay. Also, you never want to leave pills at the bedside. If your resident is not ready to take that medicine, you take it with you. I will put their name on it and stick it in the top of my drawer. And then make sure that I come back within that medication window. If I come after that, I cannot give them those pills. It's done with. Okay. All right, so controlled substances again are double locked. Your cart, your medication cart will be separated by the forms. So topical medications, your creams, ointments, lotions, things like that, they're going to be in one drawer. Your powders and liquids are going to be in a drawer. All of your over-the-counter meds are going to be in a drawer. Your diabetic supplies will be in a drawer by itself. They're all just housed by their form. Okay. Um, and the rationale behind that is storing medication separately by the route of administration can help reduce medication errors and improve safety. Slide 14. Again, a lot of those drugs, if they come in a glass brown bottle, that medication cannot be exposed to the sunlight. Okay. Make sure that if a medication has to be refrigerated, it is only placed in a refrigerator that is designated for meds only. You do not need to have food or beverages in that refrigerator. Okay. And if it's a narcotic, it must have a lock on the box. Okay. So another reason why we don't leave meds on the top of the cart is because confused patients can come by and grab them and take them, or some a visitor can come by and grab them and put them in their pocket. All right. And then the reason why we don't leave meds at the bedside is because that resident probably won't take them or they may forget. And a confused resident can walk into the room and grab those pills and they take them and nobody will know. Okay. There are instances on slide 16 where you are to discard or throw away medication. So those just list out some reasons there. If the medication has expired by the due date, or if there's no longer an order, we get rid of the med. If it is contaminated or damaged, we get rid of it. If they have an allergic reaction, if the treatment plan changed, if they leave the facility, if they die, those are reasons why we would get rid of a medication. Again, if it's narcotics, I have to have a witness to watch me get rid of it, and they have to sign that they watched me. Okay. All right, so on slide 18, it just reiterates that. So I want you to highlight the second bullet point in the last one. 2 healthcare workers must be present when controlled substances are discarded / destroyed. There has to be documentation for that. Some medications may be flushed to ensure they cannot be assessed after disposal, like your patches. Um, when it comes to discarding meds, always follow the policy of the facility. Resident privacy must be protected when disposing of medication containers. So let's just say that this card is now empty. I can tear this part here off that has her label, that has all of her information. I will tear this off, or you could cut it off. This part here that has the patient information goes in the shred box, not the trash can. Okay, we have other people that pick up our trash and take it to a dump site. Right, this part here can go in the trash. But anything that has their name on it, that's on their medication containers that are not empty, we have to discard of it. So if I'm using this bottle and it's empty, before I discard of it, I can take a permanent marker and just mark throughout the name, and then I can throw it away. Um, if you're using the strip packs that has their name and all of the list of their medications on there, you save all of those to the end of your med pass. So when you go to your facility, you're not throwing those in the trash. You need to get you a little bucket or something that you could keep on the cart and put all of those packs, because it has the patient's name on them. Those go in the shred container, not the trash. Okay. And that was chapter 7.